Hello, my name is Allie Pouch. Welcome to my education capstone. The topic that I chose was the effects of abuse and neglect on student behavior and learning. Here is the content of my presentation. There will be an introduction, definition of terms, personal experience, literature review on the impact of abuse on academic performance, mental health problems, social and emotional difficulties, behavior problems, and recommendations for teachers. There will be a conclusion, references, and questions at the end. Here is the introduction. The problem of abuse. At least 1 in 7 children in the United States experienced abuse and/or neglect in 2018, and nearly 1,770 children died from it in that same year. There are long-term consequences of abuse and neglect. Abuse can have effects on the following: attention span, executive functioning capabilities, impairments in spatial working memory, performances, and pattern recognition, high levels of anxiety, abnormal stress responses, negative behavior in school, and difficulties understanding others' emotions. Here are my definition of terms. Some studies I reviewed differentiated between the terms physical abuse and physical neglect. Neglect is the failure of a parent to provide for the development of a child in one or more of the following areas: health, education, emotional development, nutrition, shelter, and safe living conditions. Some studies combined emotional and physical abuse. Emotional abuse is psychological abuse, which can include rejection, threatening, ridiculing, intimidating, and physically harming the child. Some studies use the term maltreatment, but they did not specify the forms. And then lastly, there is adverse childhood experiences, otherwise known as ACE. This is abuse, neglect, and other household-related problems, such as witnessing violence in the home. Now we'll move on to my personal experience. I chose this topic because I was abused growing up by my adoptive parents, both my sister and I. So I will share the timeline of events. We were adopted from an orphanage in Tula, Russia. Me with my half-sister. I was 7 and she was 6. We were adopted by a family that lived in Mount Pleasant, South Carolina. They had a biological daughter who was younger than the both of us. Shortly after living there, we were made to stop speaking our native language due to the fact that our adoptive parents could not understand what my sister and I were saying to each other. We started going to school pretty shortly after we were adopted. We were just picking up on learning English, so we were not fluent yet, and that may have hindered our learning even more. But we got punished for struggling in school. My parents never took the time to sit down with us and help with our homework. If we came home and did not know how to do homework, we were physically abused, verbally, and mentally. I remember sitting in the bathroom all night because I could not figure out the answers to my homework problems, and this happened multiple times, as well as not getting meals. We had to get perfect grades or we were in a lot of trouble. This occurred for years. Up until 6th grade, DSS got involved. An incident happened where the guidance counselor at my middle school pulled me out of class, and she called DSS after seeing the evidence of what my parents did from the night before. My parents were arrested later on that day. We were taken to DSS to have interviews all day. We ended up living in foster care for a week while my parents were in court. They ended up finding them guilty. So we had to live with other family members for 3 to 4 months. During this time, we were going to therapy with my parents. When DSS thought it was safe for us to come back home, we did. The minute I stepped foot in the house, my parents turned against me and threatened to send me away to this camp. They ended up sending me to About Face boot camp. I stayed there for 6 months. No one knew I was there. I had a lot of family members and other friends trying to call to reach out to me and know where I was because they just sent me away. Um, the camp actually ended up getting shut down for failing to file annual reports 9 years in a row. So I was there at that camp. It wasn't the best of the situation. After it was time for me to go home, my parents decided to give me away. They did not want me to come live with them anymore. So I moved to Greenville, South Carolina to live with my aunt and uncle, which I currently live with. I continue to live with the effects of the abuse from my childhood. And this is why this subject is very important to me, because I would like for teachers in elementary school to pick up those signs in the classroom so they can intervene as early as possible. Here is the literature review. If you click on the link, it will send you to a document of all the studies that I included in my paper. I reviewed 26 different studies. They were all empirical, peer-reviewed, conducted from a total of 9 different countries. 18 of these studies had a control group, so I can be confident in saying that these characteristics described in each study are a result of the abuse that participants had experienced. I will scroll through the list and go over it in more detail in the next section. Our first subtopic of the literature review is the impact of abuse on academic performance. Elklet, Michelson, and Murphy found that children who had experienced maltreatment showed higher levels of problems with concentrating and needing educational assistance. Pears et al. Found that children who had a history of maltreatment in foster care placement had lower language skills and needed more academic support than non-maltreated children. Frederick and Goddard found that all participants who had left school at 16 to escape the abuse in their homes had experienced bullying due to hygiene-related issues, which led to a lack of confidence in school. Duke and Hoffe et al. Found that children who had experienced abuse and neglect showed poor educational outcomes. Here is more impact of abuse on academic performance. Hart et al. Compared brain function differences in adolescents who had experienced abuse and neglect and found reduced connectivity in the brain regions responsible for sustaining attention. Bick and Nelson found that abused individuals experienced low working memory and low performance in school. Spann et al. Found that abused individuals showed decreased executive functioning and cognitive inflexibility. McGuire et al. Found that abused and neglected individuals experienced low self-esteem, depression, difficulty regulating emotions, attention deficits, and externalizing behaviors. Major et al. Found that emotional and physical abuse were correlated with impaired spatial working memory performance and memory deficits in childhood. Here are the mental health problems. Liao et al. Found brain changes in the right putamen, which is associated with anxiety disorders, OCD, and PTSD of abused individuals. There was a higher level of putamen in the individuals who had been abused. Mori et al. Found lower volumes of VMPFC, otherwise known as ventromedial prefrontal cortex, of maltreated individuals. This is located in the frontal lobe of the brain and it plays a role in regulating emotions, decision-making, and responses to danger. Rice et al. Found that children who experienced severe neglect in institutions had elevated cortisol levels associated with stress response after interacting with their adoptive mothers, so they continued to live in an alarmed state. Here are some more mental health problems. Greason et al. Found that individuals who had experienced more than one type of abuse were more likely to experience PTSD, externalizing behavior problems, and have a clinical mental health diagnosis. Guadiano and Zimmerman found that individuals receiving outpatient psychiatric treatment for major depressive disorder who had experienced childhood abuse were more likely than other patients to experience psychotic episodes, including hallucinations and delusions. Here are some social and emotional difficulties. Luke and Banerjee found that compared to non-abused individuals, abused individuals experienced abnormal stress responses, displayed negative behavior in school, and had difficulty understanding others' emotions. Kuzumi and Takagishi also found that abused individuals had difficulty understanding others' emotions. Moreno-Manso et al. Found that individuals who had experienced abuse had difficulty expressing their feelings, often had unpredictable emotional reactions, and struggled to take other people's perspectives. These problems with expressing and understanding emotions contributed to their difficulties in social communication. Here are some more social and emotional difficulties. O'Reilly and Peterson found that abused individuals showed extreme delays in their theory of mind development. This is your ability to understand the mental states of others. McGuire et al. Found that individuals who had experienced emotional or physical neglect experienced low self-esteem, depression, difficulty regulating emotions, attention deficits, and externalizing behaviors. Here are some more social and emotional difficulties. Naughton et al. Found that abused individuals experienced low self-esteem, depression, difficulty regulating emotions, attention deficit, and externalizing behaviors. They were more likely to experience peer rejection. Lim and Lee also found correlations between parental neglect and negative school adjustment. Adolescents who had been neglected showed signs of withdrawal and depression. They had difficulty keeping close relationships with their peers, and they did not engage in school activities. They had a negative view of their self-worth and ability, and this led to a low academic performance. Here are some behavior problems. Pears et al. Found that maltreated children showed lower levels of social emotional competence. They displayed aggression, conduct problems, disruptive behaviors, withdrawal, loneliness, and difficulties with emotion regulation. There was also an association between these problems occurring in childhood and adolescence. Thibodeau et al. Found that childhood maltreatment led to adolescent sexual risk behaviors, otherwise known as SRBs. These maltreated individuals showed a higher level of casual sexual behavior and a higher number of sexual partners. Adolescents who had been neglected might depend on others for approval and have concerns about rejecting, which leads them to anxious attachment, or they reject intimacy and closeness, which is known as avoidant attachment. Here are some recommendations for teachers. Whitson and Cannell found a correlation between child abuse and neglect with functioning mental health. They studied the impact of support children got in systems of care, otherwise known as SOC. After children spent time in care, there was a decrease in their internalizing symptoms and an increase in their behavior and emotional strength. Through early intervention, long-term negative effects can be minimized, which I mentioned earlier. Bellis et al. Found that abused individuals showed reduced health-harming behaviors in adulthood after having an always available adult, or an AAA. So the more support an individual has, the less likely they are to experience mental health problems. This is the importance of intervention. Abuse can affect an individual's academic performance, mental health, social and emotional difficulties, and it can cause behavior problems. There can be long-lasting consequences from abuse and neglect, so it is important for teachers to intervene as soon as they see the signs in their classroom. Here are some tips for teachers. It is important to build trusting interpersonal relationships through sensitive and consistent caregiving practices to make the school environment safe and predictable. You can also encourage students to participate in extracurricular activities, which will lead to a sense of belonging and higher self-esteem. Here are some more recommendations for teachers. Armstrong et al. Found that student-teacher relationships led to increased student academic success. Students performed better academically, and they had more of a positive attitude in school. They also felt less lonely. Sarah and Cyphers conducted a study on self-esteem related to abuse and neglect, leading to suicide attempts. They found that an increase in service led to a higher self-esteem in children who were maltreated. So becoming involved in the community decreased an individual's level of suicide attempts. So here are some more recommendations for teachers. Teachers can provide life skills training for abused and neglected students. Life skills to maintain positive, personal, and professional relationships include socialization skills, communication skills, problem-solving skills and coping skills, conflict management skills, personal hygiene, and educational planning. So, as the research showed, abused students have difficulty maintaining peer relationships, expressing themselves, and communicating, so it is important for abused children to learn these life skills. Here are some other recommendations. So, because of maltreated students, attention deficits, and learning difficulties, it is important for teachers to check with the students to see if they understand what is required of them, allow time for breaks, minimize changes in their routine, be sensitive to the effects of abuse on emotions, self-esteem, and difficulty regulating feelings. Also, teachers need to include positive reinforcement and feedback. This is all from the Centers for Disease Control and Prevention. Teachers also need to inform the principal so potential abuse can be reported and the child can receive appropriate therapy, according to the Mayo Clinic. Skills training related to substance abuse prevention includes SAMHSA, or the Substance Abuse and Mental Health Services Administration. Here is my conclusion. Childhood abuse and neglect is a serious problem with serious outcomes for students in childhood and adulthood. Teachers need to know how to recognize the signs and how to intervene to minimize the students' poor education, mental health, and behavioral outcomes. Here are my references. Do you have any questions? Thank you.